This video discusses the sole of the foot. Sole is the area of the foot which touches the ground. We'll talk from superficial to deep, starting from skin, then subcutaneous tissue, and then fascia, and then muscles. So the skin of the sole is thicker than the other areas of the body, and also prominently thick over the major weight-bearing areas such as heels, lateral margins, and the ball of the foot. Bottom of your right hand side, you can see this diagram. This is the skin, then subcutaneous tissue, and then the fascia, and then the muscle layers. The subcutaneous tissue of the sole is different from the rest of the body. It is more fibrous, and a septa running in the subcutaneous tissue which anchor the skin to the fascia, underlying plantar aponeurosis, which is the deep fascia of the sole, and this anchoring limit the skin mobility of the sole. And also these septa divide the subcutaneous tissue into small loculi, and these loculi are filled with fluid fat under tension. Because of this arrangement of the sole, the subcutaneous tissue acts as a shock absorbing pad, especially over the heels. Then we'll talk about the cutaneous innervation. So when it comes to sole, its medial aspect is innervated by the saphenous nerve, and the lateral aspect is by the sural nerve, and the medial and lateral plantar nerves derived from the tibial nerve supply the innervation of the most of the sole. And when it comes to the demarcation of the cutaneous supply by the medial and lateral plantar nerves, medial aspect and the medial 3.5 toes supplied by the medial plantar nerve, lateral plantar nerve supplied the lateral aspect and lateral 1.5 toes. This demarcation lies on the 4th toe. Heel is supplied by the medial calcaneal branch of the tibial nerve. We discussed skin and then subcutaneous tissue. Then we'll move on to the deep fascia. So deep fascia is the plantar fascia here. Now this deep fascia has thickened centrally, which we call plantar aponeurosis. So this plantar aponeurosis arises from the medial process of the calcaneus and fans out over the sole. It divides into 5 bands, one for each toe, and attached to the bases of the proximal phalanges. Superficial transverse ligament which lie closer to the metatarsal heads connects these 5 bands. Medial and lateral aspect from these plantar aponeurosis, the fascia usually weaker than the central plantar aponeurosis. Now again, from this plantar aponeurosis, there are 2 septa penetrate the sole and attach to first and fifth metatarsal bones. Actually, these 2 septa do is, it separates the central region from the medial and lateral regions. So centrally located flexi digitorum brevis and laterally located abductor digiti minimi and medially abductor hallucis. So central area is separated by these medial and lateral parts and confine this flexor digitorum brevis into one compartment and the other 2 muscles into 2 compartments by the septa. We'll discuss how these muscles of the sole arranged in layers in coming slides. So muscles of sole arranged into 4 layers. If we talk about from skin to upwards, skin, subcutaneous tissue, then we had the fascia, then the muscle layers appear. So some layers consist of muscles, some layers consist of tendons of the long muscles, such as first layer consists of 3 muscles which we just touched, flexor digitorum brevis centrally, and then the abductor hallucis medially and abductor digiti minimi laterally. Then beneath that the second layer exists. It consists of tendons of flexor hallucis longus, tendon of flexor digitorum longus, quadratus plantae muscle or the flexor accessorius muscle, and the lumbricals. Then the third layer consists of short muscles. These muscles confine to the metatarsal region of the sole. So these consist of flexor hallucis brevis, adductor hallucis, and flexor digiti minimi brevis. Into the fourth layer, plantar and dorsal interosseous muscles and peroneus longus tendon as well as the tibialis posterior tendon includes. So we'll discuss what are the contents of the first layer. The centrally located flexor digitorum brevis is the first muscle we are going to discuss. So this is belong to the first muscle layer. This origins from the medial process of calcaneus and from the deep surface of the plantar aponeurosis, and then it divided into 4 tendons. Now there is no tendon to the big toe from this muscle because big toe has its flexor hallucis brevis in the third muscle layer. So it doesn't need any brevis tendon. So these 4 tendons inserted into the sides of the middle phalanges. The action of the muscle is flexion of these 4 toes, and this is innervated by the medial plantar nerve. You can also see here laterally it consists of abducted digiti minimi and medially placed abductor hallucis. We'll discuss in coming slides. We'll talk about the abductor hallucis. This is the muscle. It arises from the medial process of the calcaneus and also from the flexor retinaculum and insert into the base of the proximal phalanx of the big toe. It is also innervated by the medial plantar nerve, and it does is abduction of the big toe. Abducted digiti minimi is this muscle, arise from medial and lateral processes of calcaneus and inserts into the base of proximal phalanx and tubercle of fifth metatarsal. And this is innervated by the lateral plantar nerve, and it does is abduction of the little toe. So these are the 3 muscles which consist the first layer of the sole, and then the second layer. Now the second layer, it consists of long flexor tendons and muscles arise from these tendons. So we'll see what are those. Now the second layer contains tendon of flexor hallucis longus. This is the flexor hallucis longus. This muscle belongs to the posterior compartment of the leg, and hallucis means it is going to end in the big toe. This is the tendon. Now this flexor hallucis longus, you can see deep to it, it is crossed by the tendon of the flexor digitorum longus. And this tendon go along the sole and insert into the base of the distal phalanx of the big toe. Throughout the sole, this tendon invested by a synovial sheath. And then we have the tendon of flexor digitorum longus, this tendon. It crosses superficial to flexor hallucis longus and divide into 4 tendons. You can see here. And it receives the insertion of quadratus plantae muscle or the flexor accessorius muscle. This is the muscle. And also you can see from these tendons, lumbrical muscles arise. These tendons inserted into the bases of the distal phalanges of the second, third and fourth toes. So up to now in the second layer we discussed flexor digitorum longus tendon and flexor hallucis longus tendon. So next structure we are going to discuss include into the second layer is the quadratus plantae or flexor accessorius muscle. This arises as 2 heads. So medial head arises from the medial surface of calcaneus and the lateral head arises from the lateral border of calcaneus. Both converge to form the muscle belly and inserts into the flexor digitorum longus tendon. Just about to this tendon divide into separate 4 tendons. Nerve supply to this muscle is by the lateral plantar nerve, and the action of this muscle is to pull on the tendon of flexor digitorum longus, which is this muscle inserts and flexes the lateral 4 toes. So we just talk about the lumbricals. This picture might not very clear, but you can identify muscles. These are the lumbricals arise from the tendon of flexor digitorum longus. So if we count from medially, this is the first lumbrical origin as a single head. But other 3 lumbricals, they origin from the adjacent tendon as well. So they have 2 heads. But only the first lumbrical has single head. First lumbrical origin from the medial side of the first tendon, and other 3 lumbricals origin from the its own tendon and the adjacent tendon as well. So these tendons inserts into the tensor expansions, and what they do is extension of digits at interphalangeal joints while the flexor digitorum longus tendon flexing the toes. So in walking and running, these tendons do not buckle under the toes. First lumbrical is supplied by the medial plantar nerve and the other three lumbricals are supplied by the lateral plantar nerve. Then we'll move on to the third layer. So this third layer consists of muscles which confine to the metatarsal region of the foot. These are small muscles. So two muscles act on big toe, one muscle act on little toe. So what are the two muscles act on big toe? One is flexor hallucis brevis muscle and the other one is adductor hallucis muscle. We'll first talk about the flexor hallucis brevis. Now it originates from the cuboid, lateral cuneiform and tendon of tibialis posterior. Then the main muscle belly splits into two and inserts into medial and lateral sides of the base of proximal phalanx of big toe. Now at the insertion, it has two sesamoid bones. This muscle is supplied by the medial plantar nerve. What it does is do flexion of the big toe. Then the next muscle is adductor hallucis. Now it has two heads, origin from two different regions. It has oblique head and the transverse head. Oblique head arises from the long plantar ligaments and base of second, third and fourth metatarsals. And the transverse head, it has no bony origin but arises from the deep transverse ligament and plantar ligaments of lateral four metatarsophalangeal joints. Now these two heads unite in a short tendon and insert into the lateral side of the base of the proximal phalanx of big toe. Nerve supplied by the lateral plantar nerve, and this muscle assists to maintain transverse foot arch and pull the big toe toward the midline of the foot. Next muscle is flexor digiti minimi brevis. So this origin from the base of the fifth metatarsal bone. Muscle belly lies directly underneath the fifth metatarsal bone and inserts into the base of the proximal phalanx. And then again the lateral plantar nerve supplies this muscle and it also assists in flexing the little toe. Then we'll move on to the fourth layer. This is the deepest layer in the sole. Fourth layer consists of interosseous muscle. It has plantar interossei and the dorsal interossei. So plantar interossei, you can remember its function as a mnemonic pad. It means plantar interossei do adduction. Dorsal interossei dab. It means dorsal interossei do abduction. So when defining adduction and abduction, this axis lies along the metatarsal bone and the phalanx of the second toe. So referring to this axis, we are decide whether it is abduction or adduction. First, we'll talk about the plantar interossei. So these are the plantar interossei. You can see there are three muscles, three interossei muscles, which arise from the lateral three metatarsals. So plantar interosseous are three in number for lateral three toes. No plantar interosseous for the second toe. And as big toe has the adductor hallucis, no separate interossei for it as well because these plantar interossei do adduction. These interossei origin from its own metatarsal bone as single head and inserts into the bases of proximal phalanges and two dorsal extensor expansion. These three supplied by the lateral plantar nerve and what they do is they adduct the toes toward the second toe. Dorsal interossei muscles, four in number. They origin from the adjacent metatarsal bones as two heads. What they do is they abduct toes away from the axis of the second toe. And second toe needs abductor on each side. And the third and fourth toes have single abductor. Because big toe and little toe have their own abductors, abductor hallucis and abductor digiti minimi, they don't have any abductors. These dorsal interossei inserts into the dorsal extensor expansion and also to the bases of proximal phalanges. This dorsal interossei are also supplied by the plantar nerve. So you can remember all the interossei, whether it is dorsal or plantar, all are innervated by the lateral plantar nerve. So then the next one we are going to discuss is the tendon of peroneus longus, which belong to the fourth layer. This is the peroneus longus muscle in the fibular compartment of the leg. So you can see its tendon approaching to the sole from the lateral aspect. So at the lateral margin of the foot, the ligament contains sesamoid fibrocartilage. In this middle picture you can see this is the lateral, this is the medial aspect. Now it's approaching to the sole and where this is where the cuboid bone located. Now this tendon lies in the groove in the cuboid bone, which converted into a tunnel by the overlying long plantar ligament. So long plantar ligament also help to keep this tendon in position when it crosses the cuboid bone. And then this ligament emerging from the tunnel and crosses the sole obliquely. This inserts into the base of the first metatarsal and adjoining lateral surface of medial cuneiform. Then the tibialis posterior tendon. This tendon is the tendon of tibialis posterior muscle, which is a muscle of the posterior compartment of the leg. This lies above the sustentaculum tali of the calcaneus and the spring ligament. Here you can see this is the plantar calcaneonavicular ligament or the spring ligament, and inserted mainly into the tuberosity of the navicular. Now from this insertion, several bands passes to several bones. One is passes to sustentaculum tali and 3 cuneiforms, and also into the groove of the cuboid and bases of second, third and fourth metatarsal bones. So those are the muscle layers belong to the sole of the foot. Then we'll discuss what is the blood supply and nerve supply. Blood supply derived from the posterior tibial artery and the nerve supply derived from the tibial nerve. Now these nerves and vessels lie between the first and second layer, inferior to the long tendons. Now both posterior tibial artery and the tibial nerve divide into medial plantar and lateral plantar branches under the flexor retinaculum. So we can say posterior tibial artery branches into lateral plantar artery and the medial plantar artery, and the tibial nerve give rise to medial plantar nerve and the lateral plantar nerve. So first we'll discuss about the medial plantar artery. This is the medial plantar artery. You can see origin from the posterior tibial artery. Now this medial plantar artery not contribute to plantar arch, but it supplies to the big toe only. You can see this is the artery. You can see nice plantar arch from the lateral plantar artery. We'll discuss what is it. In the foot, there is only one plantar arch, which is derived from the lateral plantar artery. We can see the medial plantar artery is not going to contribute to this arch, but derived only from the lateral plantar artery. This artery crosses obliquely over the sole, deep to the first layer, and it reached towards the base of the fifth metatarsal, and the main trunk form plantar arch across the second, third and fourth metatarsal heads, this region, and it joined the dorsalis pedis artery at the first intermetatarsal space. Now this convex plantar arch give rise to plantar metatarsal arteries. These supply the forearms and toes by dividing into digital branches. It give rise to perforating arteries also. The perforating vessels origin from the plantar arch. You can see these are the perforating arteries. They join to dorsal metatarsal arteries. So you can see there is a connection between or arterial anastomosis between the dorsal arterial supply and the plantar arterial supply. Then we'll move on to the veins. We can discuss veins by superficial veins and the deep veins in the sole. Deep veins usually accompany arteries and located deep to the deep fascia. Now the superficial veins, which located subcutaneously, usually not accompany arteries, and when it comes to clinical importance, it has very small clinical importance. So in depth we are not going to discuss. Usually superficial veins of the sole arranged as a network, tiny network of veins. Now the veins of the sole accompanying the perforating arteries drain most of the blood from the sole to the dorsal venous arch. So we'll talk about the deep venous system. So the deep system starts with the plantar digital veins, you can see in the digital area. So these plantar digital veins form plantar metatarsal veins, and they join to form the deep plantar venous arch. Then from this deep plantar venous arch, medial and lateral plantar veins arise, and they join to form the posterior tibial vein. Also the lateral plantar vein give rise to the peroneal veins, which are the vena comitatus, run with fibular artery. Lymph drainage of the foot is through medial and lateral superficial lymphatic vessels. Now, these vessels follow the small and great saphenous veins. Lateral lymph drainage is into the popliteal lymph nodes along the short saphenous or small saphenous vein, and the medial lymph drainage is into the superficial inguinal nodes. So far we discussed the sole from skin to the deeper. We discussed about the skin, then subcutaneous tissue, how its deep fascia arranged into plantar aponeurosis, and then 4 layers of the muscles and tendons, how its arrangement, and then the blood supply, nervous supply, and the venous drainage and the lymph drainage. I think you can have some clear idea about the sole of the foot. Thank you. Stay connected with Anatomy Everywhere YouTube channel.